Alzheimer himself actually saw in the first case of a recorded case of Alzheimer's disease, although it wasn't called Alzheimer's when he discovered it. But so Alzheimer's disease is named after the individual who saw somebody's brain that was, had a particular type of pathology, but that individual also had a particular type of psychological changes known as dementia. So it's true that when my mom asked, if I can't remember what I had for breakfast, do I have dementia or do I have Alzheimer's? Well, 65, it's a likelihood of 65% that you do, but I'm not going to say that. So it is, Alzheimer's is,
How old is your mother?
Old is she? 83 right now. So I'm the youngest member out of 7 kids. Alzheimer's does account for about 65% of the cases of dementia. So it is a pretty prevalent disorder. So the cause is unknown. There are a lot of different contributing factors. So as usual, there's a genetic predisposition to Alzheimer's. We have the environmental toxins back, so high levels of trace elements, so iron again, or it says aluminum there, and autoimmune response. So again, we go back to that immunity, those microglial activation, and that's something that I want to touch on again because there's some interesting work coming out of Quebec that's looking at how you can stop those microglial activation to hopefully clear out some of the pathology of Alzheimer's. A slow-acting virus, I've actually never seen anything about that, but I suppose why not? And then, again, this idea that we really covered much more in relation to MS, but this reduced blood flow, sorry, the other way around though now, it's reduced blood flow to the brain. So in this case, it would be possibly akin to mini strokes or some type of stroke that could set off this cascade of pathology associated with Alzheimer's disease. So again, the historical perspective, so it was really came about in the early 1900s. So I0001 working in Germany, and he had this patient, Mrs. Auguste Dieter. So she was 51 at the time, so you can see again that this was now, we're pushing back the time scale. Typically, you don't see Alzheimer's-like symptoms in a 51-year-old unless they've had massive head trauma throughout their life, so if they've been a fighter in hockey or whatever. So, but she had strange behavioral symptoms, including loss of short-term memory. So you can see right away that there is a memory component, but the strange behavioral symptoms, these aren't my words, those are Alzheimer's, similar to what dementia would be, so that observable behavioral change. So then when she died in 1906, Alzheimer had the patient records and the brain sent to Munich, and then the brain was actually sent back, and he identified this particular pathology. So they're called plaques and tangles. So that's, and as we go along, we'll talk more, in detail about those. But plaques and tangles are the, basically the features of Alzheimer's disease that then leads to these behavioral changes or the dementia. So that's when, so 1906 was when he first put together the clinical symptoms and the brain pathology, and then, it was named after him, Alzheimer. So again, that's the pathology, are these plaques and tangles, and as I said, we'll get into more of that as we go along. So this is actually from his slides, I think, from his report, from Alzheimer's report of Mrs. Dieter. So what he was looking at is, these are high power microscopic images of the brain. So this is in fact a individual neuron here, but what he noticed are these black, brown blobs. What then he termed plaques. So there are these, he didn't know what they were, but they were obviously not supposed to be there. So, but he called them plaques, and that's one of the main pathological features of Alzheimer's disease are these extracellular accumulations of protein. And like I said, I have a cheap visual demonstration to show how this all might come together. But so they're sitting right outside of a neuron, and what they do is they interfere with the ability of those neurons to actually communicate with each other. And then what happens is once those plaques start forming, they start to destroy the neurons, because the neurons are now getting all these, who knows what, inflammatory responses, these toxins that are infiltrating the neuron, and then the neuron's ability to communicate with its neighbor gets impaired, and so it says, fine, if we're not going to talk, I'm going to self-destruct, and so it dies, and then it keeps basically flowing throughout the brain. So that's why some people think it is a virus, because it does spread throughout the brain.
How do they detect it by an MRI?
You can, but late stage. So I'll show you what the pictures look like. You can't see these with an MRI. Like you can't see an individual cell with an MRI, so you can't actually detect those plaques, but you can detect the gross deterioration of the brain. So what is Alzheimer's disease? So as I already mentioned at the beginning of this class, it's a neurodegenerative disorder. It's characterized, as I'd already said, by these plaques and tangles. So plaques are outside of the cell, and they're deposits of these proteins that start to accumulate, and as they build up in the brain, they basically gum up the works. And oftentimes what people think is that this is what sets off Alzheimer's disease, and once you have these extracellular plaques, what that causes is the inside of the cell to develop these tangles. So, I mean, again, this is a complicated way of saying that the structure of the inside of the cell breaks down, and so now the cell can't actually function properly, and then it is destroyed, so it degenerates. So this is also kind of an interesting thing about these, so this is why people think it's some sort of an infection or a virus, because they form in a predictable pattern beginning in areas important for learning and memory, so those are the initial signs of Alzheimer's disease, is the memory loss, and then it spreads to other parts of the brain. So in this case, it's typically, so now if we turn our brain around and look at the outside, the memory parts are down in here in this temporal lobe, so that's where typically the pathology starts, and then it seems to spread, but it doesn't spread back. There doesn't seem to be typically visual problems in Alzheimer's. It spreads forward, so it starts to damage that frontal lobe, which again is important for all our higher order functioning, and that's when you get those real in-depth dementia-like problems. So again, as it says here, the most common form of dementia, as I put it earlier, but I would say it's probably better to say the most common cause of dementia. So as I said, Alzheimer defined his disorder based on the pathology of the brain, and then that will produce dementia as it spreads throughout the brain. So this is just an overview. So what you see is you have these plaques and these tangles, which ultimately, when you see, you look at a healthy brain, a mild Alzheimer's disease, and then a severe Alzheimer's disease, what starts to happen, I don't know if you can actually see that, but you can see that the healthy brain here is kind of chunky and fat and all pushed together, and as the disease progresses, you start to get this shrinkage of the cortex, so the brain actually does start to degenerate. So let me see, I'll make my little demonstration here. So when you have, a normal neuron is just this bulb here, and then you have its axon, which is, the axons in our brains are pretty flexible, they are malleable, so you can see that, so the neuron and the axon are connected in this way, so this axon can connect to other neurons. And so we all have these, not necessarily a plaque, but we have the proteins that will form these plaques in our brain, but our brain deals with it. So I have this bag of syrup, which I just happened to find. For some reason, I had a little bottle of syrup in my office, which is always a bit strange. I wanted to bring scrambled eggs, but I totally forgot about it. So we have these axons, right, that are all wobbly and nice and loosey-goosey, and then we have these proteins outside of our axons, but our brain deals with it. They're soluble. They can just be washed away like a syrup, but it's thick, so it takes a little bit of work to get them away, but they can be cleared out. So those proteins get cleared out, and the axons just go back to their normal function. These things come back, they get washed out, and so on and so forth. But in Alzheimer's disease, what starts to happen is these proteins, the syrup starts to accumulate. So it turns into black jelly beans, of course, which again, why I have these in my office is unbeknownst to me. So what happens is typically those liquidy, non-aggregated proteins will start to clump up. And so they interfere now. So they are typically, as it shows here, this clumped up plaque is at the end of an axon. So it interferes with that axon's ability to communicate with its neighbor. So if I'm the other neuron, and there's, you know, these, I knew this was going to be a problem. There's a connection here. Those plaques get in between the two. And so now this neuron has to work harder and harder to try to communicate with its neighbor. And it just, all of a sudden, after a while, it can't do it. So now, this is another thing. I found this in the lab. I don't know what it is. And I hope it's not toxic or anything. But what'll happen is you'll go from this nice, you know, malleable axon to the solid, unmalleable axon. And that's what's happening when you get these tangles. The axon gets all tangled up, and it can't do anything. It just starts to freeze up. And so what happens, I'll see if, I had to test this before I came here. So what happens is you have your, this is why I got this. So you have your axon with its tangled up, you have your neuron with its tangled up axon, you have those plaques all built up at the end, and pretty soon that neuron starts to just smush down. So it degenerates. And then it basically, let's see if it pops back. So it dies, it starts to shrink. So all that shrinking of the image that you can actually see on MRI, is based on, you know, the combined action of all these neurons that are actually dying off. So a diseased neuron because of this process. So that's why people, when they're trying to look at cures for Alzheimer's or treatments for Alzheimer's, they're going after the ability of your brain to remove those plaques. So rather than having, you know, jelly beans in your brain, you want to revert back to syrup in your brain, which my kids would love. But so to clear out those plaques, so once you clear out those plaques, then the brain won't, you know, go through this progression of its axons getting all tangled up, and then the neurons dying. And so again, what's happening when these plaques start to form is that microglia are going in to try to clean them up. So the brain is trying to take care of itself. So you get these microglia that come in there to try to chew that away, but in fact they start spitting out their own toxins, and then that's probably why the disease starts to spread throughout the brain, as those toxins just keep going and it keeps getting bigger and bigger, or it keeps spreading wider and wider throughout the brain. And ultimately, so this is probably a better picture, you see the healthy brain versus the advanced Alzheimer's. So you can see that there's a big gap there, which is not present there. It's actually even thinner, and then the valleys are actually have widened out compared to the normal brain. So there's a lot of cell loss that's happening, and it's just, you know, all those neurons shrinking. Yep.
Do people die of Alzheimer's disease, or do they die of something else?
Do they die of Alzheimer's, or do they die of something else? They die of something else. Yeah. So it's not one of those cases where something like ALS, people die of ALS because the motor neurons just stop and your heart stops and everything stops to function. But no, for some reason that the centers that are involved in keeping you alive in Alzheimer's disease keep working. So you don't ever, it's not a terminal disease, although it typically, you know, people, we were talking about this before, you develop pneumonia, so you're in the hospital a lot, and you can acquire other infections, and that's usually what causes the death. So again, what is the relation to dementia in all of this case? So Alzheimer's is the pathology that leads to a particular behavioral change, which is known as dementia. So I think this is interesting. I mean, it's a little dated now, the World Alzheimer Report from 2009, but I think it kind of illustrates some of the thinking about what's happening with dementia, with Alzheimer's disease. So aging. So the demographic aging is a worldwide process that shows the successes of improved healthcare over the last century. So we're living longer, basically, is what that's saying. But with living longer, there's other collateral damage that's happening, like Alzheimer's disease and dementia. So living longer and healthier lives, so the world population has a greater proportion of older people, which is great. So that means that our healthcare system is working. I mean, obviously, this is a clear sign of it that, you know, we are healthier as in general as a population. But again, that is putting really strains on the brain, because as the brain keeps trying to keep up with our healthy bodies, you know, it's got its own way of thinking. So I saw a quote somewhere that said, you know, we're given our brains are given 70 years, and then that's it. So the brain is at about 70, it starts to say, I've had enough. The body, you can keep going, but the brain is going to go. So that's the clear negative effect of aging, is a significant increase in the number of people with Alzheimer's disease and related dementias. And I have, pardon me, I have a slide that I'll show that as aging goes up, dementia really does almost double. So your chances of developing dementia will double every 5 years, I think. So dementia is a syndrome associated with the disease of the brain, so usually chronic. So again, that's where you can have dementia, and it can be based on a number of different pathologies in the brain. So dementia can be because you're a chronic alcoholic. Dementia can come out because you have Alzheimer's disease. Dementia can come out because you have Parkinson's disease. So there's lots of different causes of dementia, Alzheimer's being one of the most common. Yeah?
You're touching on an issue I was wondering about. Is there something about Alzheimer's-driven dementia that's worse than other types of driven dementia? Because people talk about, came up with my mother, does she have Alzheimer's? Well, she's got some form of dementia.
Right.
It doesn't really matter, but does it matter?
Does it matter what? I suppose in terms of treatment, if you want to treat it, it does. So whether you would, direct the treatment at removing those plaques versus, something in the dopamine-producing neurons, or.
But in terms of prognosis, or in terms of actual impact on
right.
the individual.
Yeah, it probably doesn't matter. No, and then again, dementia. It seems that you can have all these numbers of causes underlying dementia, but then they all sort of funnel into one characteristic behavioral output. And often, there's only, like memory is a very common form of, or common symptom of dementia. So there's only particular, so this, gives it kind of the overview of the different behavioral changes involved in dementia. So memory, learning, language, comprehension, judgment. So all of those different pathologies will funnel to all these very similar behavioral changes. So that's why, again, a lot of people will say that, well, Parkinson's disease and Alzheimer's disease are probably the same, or a similar pathology, maybe the same disease, because they ultimately lead to the same changes in behavior. So I don't think it matters to the individual what the underlying pathology is. So this is where we get, so after 65, the prevalence of developing dementia doubles with every 5-year increase in age. So again, those are, these are averages. Oops, I thought I had this slide. Anyways, I'll get to that table in a minute. So what are the different types, the symptoms or the behavioral changes associated with dementia? And then, this could be caused by a number of different underlying pathologies, one of which would be Alzheimer's disease. So agitation, aggression, sleep disturbance, wandering. So again, if you think about it, a lot of these are based on normal aging. As we, I have sleep disturbances. I don't think I wander too much, but sometimes I do. So, you have apathy. So depression is really a symptom of dementia. Aggression. Once you get into the aggression, then there's a problem. That's more of a serious issue of dementia. And, oftentimes that's a sign that something needs to be treated. Anxiety, depression, delusions and hallucinations, that's another clear sign that, this has now gone beyond the normal aging, and that it's really now should be classified as dementia. So, and then so again, this is one thing that we had talked a little bit about, but, affective disorder, so depression. So 25 to 40% have a diagnosable affective disorder or depression. And again, I think I put up that slide where as we age, depression, the incidence of depression also goes up as well. So that depression is a normal part of aging, but I think in this case, if you get to those real extreme situations where you do have suicidal tendencies, suicidal thoughts, that's where then you've sort of crossed the line into dementia. Yeah, this is something different. These symptoms are similar between developing and developed countries. So it's not something that's North American. And some of these, some cases, like something like depression has a higher incidence in North America and our society versus, let's say, Asian or African societies. But in terms of dementia, it seems that once you get to this extreme situation, then it does become a problem. It's not thought of as a normal part of aging. So here's that prevalence as it's essentially doubling from, once you hit that magic number 60, it doubles every 5 years. So 85 to 89, 20%, and that's international prevalence rate, so that's worldwide, that you can see that dementia really does increase. And so, you know, again, as I saw this quote, I was looking for quotes to how to finish this class, and there was somebody who said that, you know, the angels give our brains 70 years, and once we're up 70, then, you know, all hell can break loose. And so I think, you know, it has some potential truth to it, that once, you know, you're 70, then the brain is, you know, it's been working hard, so, you know, for so many years, and it develops all these toxins, it develops all these reactive oxygen species, that it just, part of the normal aging process, it says, okay, it's time for me to take a rest. So you can see then that if that starts to happen, the brain starts to degenerate, and then dementia happens. It's a real uplifting way to end this course, isn't it? So that could be a suggestion for a follow-up course. Happiness, yes.
I always understood that we only utilize a fraction of our brain's area or capability.
Right.
So does the degenerative process affect all of the brain in the same way?
Right, so I think that, I mean, actually that is an important question. I mean, so do we only utilize a certain percent? We do, I mean, our brains are always being fully utilized, but some parts are being utilized much more. And so that's what some people have said is because, so with, let's say, Alzheimer's, the pathology is starting in that memory-related center, that learning and memory